This video is going to review pharmacy and medical vocabulary. I want to be clear that I am not a medical doctor. I am just teaching the English words in this video for what you might need or hear while at the pharmacy or taking care of yourself. So I started my class with these pictures. This is a picture of a pharmacy. This is a pharmacist explaining medicine to a patient, okay? So pictures sometimes help us in any language to think about the vocabulary words we might be using. So I kept these slides because I wanted you to be able to take a look at these pictures of pharmacies, especially here in the United States, okay? Here are the key vocabulary words when we talk about a pharmacy or medicine. I'm going to read all of them, and then I have a document to share with you with definitions. Key vocabulary: medicines, drug, over-the-counter, drugstore, pharmacy, prescription, pharmacist, tablets, capsules, syrup, label, side effects, expiration date, patient, warning labels, dose, refill, measure, interact with, and generic drug. Let's take a look at what these words mean in English. Okay. Zoom in for you so you can see. Okay. So here's the vocabulary list, and I'm going to read through with the definitions. Medicine is something you take to feel better or treat an illness. Okay. Drug is another word for medicine. Okay. So both of these words are synonyms. They mean the same thing in English. Over the counter, or OTC, is medicine that you can buy without a doctor's note. This is any medicine that you can walk into a store and buy on your own. You can take it off the shelf and go buy it. Okay. Here in the United States, we have two different words. We have drugstore and pharmacy. They are not complete synonyms. They mean different things. A drugstore is a shop where you buy medicine and other small things like shampoo, snacks, makeup. This is a place in the United States like Walgreens or CVS. It is a store, smaller than some of our larger stores like Walmart or Target, but a small store that has a pharmacy in it. That is a drugstore, but you can buy other things there too. A pharmacy specifically is the counter inside a store where the medicine is prepared. Okay, so many large stores have pharmacies in them. A drugstore is specifically one of those smaller store locations that also has a pharmacy in it. Okay. A prescription is a formal note from a doctor for a specific medicine. Prescription drugs have to be prepared and then provided by a pharmacist. You have to go to the pharmacy to get them. Pharmacist is the professional person who prepares and gives out medicine. They are also well educated in all of the medicine. So you can ask questions and they can help you with how to take the medicine, when to take it, and side effects that you may experience. Tablets are medicine that are small, solid, round pieces of medicine. They're pills. And these are ones that you could split in half. You could take half a pill if that is how it is prescribed. A capsule looks more like a liquid. It's medicine inside a small plastic shell that you swallow. These ones you could not cut in half, okay? A syrup is a thick liquid medicine that you drink, okay? Many pills, tablets, and capsules, as adults, we swallow whole. A syrup is often used by children most of the time. They can drink the medicine. Okay. A label is a sticker on the bottle or box that tells you how to use the medicine, when to take it, how to take it. Side effects are any extra unwanted feelings from a medicine, like headache or sleepiness or stomach problems, could be side effects for medicine you're taking to help something else. Okay? Make sure you tell your healthcare provider if you're experiencing side effects when you start or take a medicine. Expiration date is the date when the medicine is no longer safe to use. Do not use expired medicine. Follow the date and get new medicine or ask your provider for new medicine if what you have has expired. A patient is the person who is sick or receiving the medicine. Warning labels are extra stickers, and we're going to look at these in my slides. They're usually very bright colors that tell you what to avoid, what not to do. So do not drive. Or they tell you take with food. Okay, it's advice, warnings, that's why they're warning labels, for what to do or not do while taking a specific medicine. Dose is the exact amount of medicine you should take at one time. It could, if it's a liquid, you could say 5 milliliters or one pill. Right? A refill is getting a new supply of your medicine when your bottle is empty. This is for prescription medicines. So your doctor, when they give you the prescription, may allow you to get 2 refills. That means that the pharmacist can give you the medicine and then they can do it 2 more times. Okay, without needing to contact your doctor or provider. Once you run out of refills, you have 0 refills, which means the pharmacy and or you need to contact your provider for a new prescription to make sure that the medicine is still correct and still what you should be taking. Measure is a verb to find the exact amount, usually a small cup or spoon for liquid. Okay, so if you're measuring out your dose, how much medicine you should be taking, you are looking for the exact amount. Interact with is a phrase in English, and it's the concept that when 2 different medicines come together, they could change how each other work in your body, which can be dangerous. It's always important to know what medicines and vitamins and supplements you are taking at a given time, so that you can ask your provider or pharmacist if there will be any interactions. Different drugs cannot be taken together because they don't work the way they should when they interact, when they come together. So this is very important information to share with anybody supporting your health. What medicines are you taking now? And will these medicines have any negative interactions with something new that you need to take? A generic drug is a version of a medicine that has the same ingredients as a brand name, but is usually cheaper, less money. We're going to take a look at this on my next slides. Okay. So here is an example of a brand name drug, Tylenol, with a generic version of it. Tylenol is the name that people know and hear, especially as a pain medicine, and it's over the counter. You can walk into a store and buy it for yourself. If I look at this, its main ingredient is acetaminophen. It is a pain reliever, fever reducer. It says extra strength, and that means 500 milligrams each. This bottle actually says, compared to Tylenol, active ingredient. It has acetaminophen, same active ingredient. It's 500 milligrams, the same dose, extra strength, pain reliever and fever reducer, pain reliever, fever reducer, okay? This is the generic name for medicine that you might purchase at Walmart, okay? So here is the brand name. Here is the generic, okay? This one also has 200 pills in it, and this one has 50. You will find that generic drugs are typically much less expensive than brand name, okay? This is just something for you to know about And it's something that you can also ask about prescription medicines with your provider. If they are prescribing you a new medicine, you can ask if there is a cheaper generic version available of that medicine, and it might save you money even with the prescription. Okay. Here's another one. Here's Sudafed, okay, for sinus congestion. The active ingredient is pseudoepinephrine, which is 30 milligrams, and it is a nasal decongestant, okay? It helps with sinus pressure, sinus congestion, okay? It's also non-drowsy, which means that it will not make you fall asleep. This is very important as a label. Non-drowsy is important to look for, okay? Especially as a parent, I need to make sure that I'm awake and alert for my children during the day. So I make sure that anything I'm buying is non-drowsy so that I do not fall asleep when I shouldn't, okay? And then here is the CVS generic, okay? It says, compared to the active ingredient in Sudafed congestion, that's what this was. It is non-drowsy, okay? Nasal decongestant, okay, nasal decongestant. Maximum strength, helps with nasal and sinus congestion and sinus pressure. Here's our pressure and congestion. And we've got the pseudoepinephrine, okay, is our active ingredient. And these are also 30 milligrams, okay? So this would be the brand name. Sudafed is a brand. This is the generic, okay? But it is the same active ingredient, okay? If you ever have questions, even about over-the-counter medicines, you can ask a pharmacist. You can take them to the pharmacy counter and ask, okay? But this may help save you money. Now we're just going to look at a few medical labels, okay? This is from Tylenol, or a generic acetaminophen. This is what you would find on an over-the-counter medication, okay? So it will always list the drug facts, what is the active ingredient, and what is it for, okay? Uses. If you have any of these, this might help you, okay? So you read this and say, oh, yes, my back does hurt, or I am looking for medicine to help with a cold, or I am looking for something that helps with a headache. Okay, this might be a good option for you. Then here are the warnings, okay? If you are any of these things, don't take it unless you ask your provider or a pharmacist, okay? These are all the reasons that you should not take this medicine. So you need to be careful with your liver. You need to be careful if you have allergies. You should stop taking this medicine if you are having a reaction. You should not use it with these other medicines, okay? You should stop using and ask a doctor or a provider if you have been experiencing this illness for this amount of time. You should always check with a provider if you are pregnant or breastfeeding, and you should always keep medicine out of reach of children, okay? We need to be very careful that nobody accidentally takes too much, adults or children. That would be an overdose, okay? This is the number for the Poison Control Center. If you or your child take too much medicine, you may need to call 911. You may need immediate help. If you feel that it is not an immediate emergency, you can call the Poison Control Center and they can advise you on next steps and support you. Okay. Finally, here are the directions for how and when to take this medicine. There's usually a suggested temperature that you should store this medicine at. Most medicine does not work as effectively if it is made too hot or too cold. All the other ingredients are listed that are inactive, and there's a number to call for the manufacturer of this drug. Okay. This is what might be included on a prescription drug. There will be the pharmacy name, the medicine name. In this case, it's amoxicillin. Okay. How much medicine to give, how to give it, and how often to give it. Okay, so we're taking one pill by mouth 2 times a day. Okay, those are the instructions. This is the patient, or in this case, a child's name and information. Refills you have left, 0. So you cannot go back to your pharmacy and just get more amoxicillin. They need to check back in with your provider, or you need to do so. The dose, this is a 250 milligram pill. And QTY stands for quantity. How many? So there are 10 pills in this bottle. Okay? There's also often a side label, which contains the same information. Here's another example, especially for liquid medicines. You might have the pharmacy name and all their information, address, phone number. You can always call if you have questions, and address, your name or your child's name, okay, with your information. Again, how much medicine to give, how to give it, and how often. So since this one is a liquid, you're taking 2.5 milliliters, which is half a teaspoon, by mouth 2 times a day. They're looking at amoxicillin again, same medicine as before. Same dose, 250 milligrams, but as a liquid, that's 5 milliliters, okay? Because you're taking it 2 times a day. And again, there are 0 refills, okay? In total, there are 50 milliliters in this bottle. This is more what my prescriptions look like personally. There is a lot of information, but it is all important, okay? I'm going to start here, okay, and go down and explain around, okay? So here's the pharmacy name and address if you need them. Here's the patient name and address. This is me, okay? The name and strength of the drug. This is metformin. It is a tablet. It is 1,000 milligrams, okay? Drug instructions, take 1 tablet by mouth daily. Physical description of the drug. This tells you what the actual drug looks like. If you ever drop it, or you're holding 2 pills and you're trying to figure out which one is your metformin. It is an oval white tablet with 271 on it. Okay, you should be able to look closely at the tablet. This is the pharmaceutical manufacturer. This is who makes the drug that you're taking. Here's your expiration date. Don't use the drug past this date. There's usually a federal statement. Of course, prescription medicine is only for you. Do not give it to anybody else. Here's the date the prescription was written. So this is when the doctor or provider sent the order. And this is the day that they made the order ready for you to pick up, okay? The date the drug was filled. And this is the pharmacist in charge, okay? Number of pills, again, here's quantity. So there's 90 pills of 90 total. Date to place your refill order, okay? If you have refills, which this one does, as of December 20th of this year, you could say, I'm ready for my next bottle, okay? And the pharmacy will get it ready for you. Here's the pharmacy phone number. Here's your doctor's name. This is short for prescriber. This is who is prescribing you this medicine, okay? So doctor, or here in New York, nurse practitioner or physician assistant. This is the number used by the pharmacy to identify your prescription. So if you call in for a refill, they will ask you the RX number. That's the number for this specific medicine, specific for you, okay? And this has 3 refills, okay? So you can call in, or probably use an app on your phone too, to request a new bottle of this medicine when you're ready. And here are some of those warning labels that I mentioned in the vocabulary. These may be put onto prescription medicines. Take with food. It may help the medicine work better or help avoid side effects. May cause drowsiness, which means it may make you sleepy or dizzy. If you're trying a new medicine that may cause drowsiness, make sure that you are in a safe space so that you do not need to drive or use dangerous machines while trying medicine for the first time. Especially with liquid medicine, it often says shake well before using. Make sure you get it totally mixed so that the medicine is effective. For external use only, this means that you should not swallow this medicine or put it inside your body in any way. This is often on creams if you're using something for your skin. For external use only, it's not meant to go inside. Do not chew or crush, swallow whole. This is supposed to be the picture of like a stomach. And here's the pill, okay? So do not squish the pill or chew the pill. It could be dangerous. Swallow it whole. Medication should be taken with plenty of water. This, of course, can keep medicine or pills that you're swallowing from getting stuck. But it can also be important depending on what the medication is for, that you are staying well hydrated. And do not drink alcoholic beverages when taking medicine, okay? This is a warning for many medications. Mixing alcohol and medicine can be very dangerous and can make you feel worse. Always ask your primary care provider or your pharmacist if you have any questions, especially about these warnings. Thank you so much for watching this video. I hope that you found it helpful.